Welcome to Congressman Brindisi's fourth coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. Thank you for joining us for another informative discussion with Q&A about COVID-19. In addition to hearing from the Congressman this evening, we've got a local doctor and representatives from the SBA and the IRS on the line to answer your questions. We're going to be starting the call shortly, but we'll let folks continue to dial in for a few more minutes. If you're interested in asking a question, all you need to do is to press *3, and when we get to the Q&A, it will be placed in a queue. For folks just joining us, welcome to Congressman Brindisi's fourth coronavirus Tele-Town Hall. I'm Sarah Borman, Anthony's District Director, and I'll be your moderator this evening. In addition to hearing from the Congressman, we've got a local doctor and representatives from the Small Business Administration and the Internal Revenue Service to answer your questions. If you do have a question that you'd like to ask, all you have to do is press *3. That's *3 to ask a question. We do anticipate receiving a lot of questions this evening, and we'll do our best to get through as many of them as possible. If you don't get to ask your question, though, please do hold on the line and leave a message so we can get back to you. We'll get started in just a minute, but just wanted to remind everyone that the way to ask a question is to press *3. *3 asks the question. For folks just joining us, welcome to Congressman Brindisi's fourth coronavirus Tele-Town Hall. We'll get started in just a moment, but in addition to hearing from the Congressman this evening, we've got a local doctor and representatives from the SBA and the IRS. In order to ask a question, all you'll have to do is press *3, and we're going to try to get through as many of them as we can. So let's start this off. Anthony, let me turn the proverbial microphone over to you.
All right. Well, thank you, Sarah, for moderating the call tonight, and I want to thank everyone for joining the call today and taking time out of your evenings to join me. Like many of you, I understand how scary this is and how desperate you are for answers, and that's why we're holding this event tonight. We want to answer your questions, provide the information you need to protect yourself and your family, provide you with an update on the federal response to the crisis, and give you the confidence that our office is doing everything we can to keep our community safe and be a resource for all of your questions. I'm holding this town hall tonight because I want to bring together experts from the IRS, the Small Business Administration, and a local physician from the Mohawk Valley Health System to answer your questions. We are now more than 1 month into our staying at home and doing our part to flatten the curve. New York State has been hit the hardest, and my prayers go out to each and every family affected by this virus and all our essential workers. In order to do our part, we need to continue to listen to the healthcare experts, practice social distancing, and wear masks when we are out in public. These steps will help mitigate the crisis and keep our loved ones safe. Like many of you, I'm a parent of young kids, and as parents become homeschoolers, sons and daughters become caregivers, and we all step up to do our part, it's time for renewed diligence. Tonight, I will give a brief update on the response at the federal level and then introduce our panel of experts. Last month, the Congress passed and the President signed the Bipartisan CARES Act to provide relief to our small businesses, expand unemployment, send checks to the majority of Americans, get money to our hospitals, personal protective equipment to our frontline workers, and expand COVID-19 testing. Unfortunately, many working people and businesses have had issues with these programs, and even some bad actors trying to scam people out of their benefits. That's why we have the experts on with us tonight to answer your questions and provide guidance about where and when you should be receiving your checks or information about any of the small business assistance. I'm also working with Democrats and Republicans to strengthen programs like the Paycheck Protection Program for small businesses and expand our economic injury disaster loans to small businesses and farmers. These programs, administered by the Small Business Administration, are not perfect, and I fought to establish safeguards and a roadmap for getting more money to mom and pop businesses rather than big multinational corporations. But I know this can't be the last aid package. I've heard from workers, families, hospitals, nurses, small business owners, and the recently unemployed that they are still hurting. I'm here tonight to say I hear you, and I promise that I will not stop fighting for you. Negotiations on the next coronavirus relief package have already begun, and I think we need to make sure that this next package protects our heroes, our healthcare workers, the first responders, police, fire, EMS, our transportation workers, food service, and postal service. These are the people risking their lives right now to protect our public health and to keep our economy moving. We're all in this together, and Washington needs to put partisan politics aside and do the right thing to help our country get through this and recover. As always, if you're having trouble getting the help or resources you need, do not hesitate to call my office. With that, I'd like to introduce our experts tonight. First, we will hear from Dr. Kent Hall, Chief Physician Executive from Mohawk Valley Health System. Dr. Hall, thank you for being with us.
Thank you, Congressman, and thank you, everyone, for having me on with you. And good afternoon to everybody who is listening. So just to give you a little bit of background of myself, so I'm the Chief Physician Executive at Mohawk Valley Health System, as the Congressman said. I'm an emergency physician by training. I grew up in the Mohawk Valley, in the eastern section of it. I grew up in Schenectady. I've spent the last 8 or 9 years in the Plattsburgh area, and I'm very proud to call myself a New Yorker. In this time, I am, if anything, even more proud because I think that our community and our state has weathered and continues to weather a very difficult and dangerous storm. I believe that our region has done an excellent job in stepping up to the plate to keep people safe by following what seem to be fairly simple but at the same time very difficult things of wearing masks, washing your hands, covering your cough, and monitoring yourself. I know that this is very scary. It doesn't have to be overly scary because if you do those simple things, then you can actually keep yourself and your loved ones safe. So just to give you a little primer, some of you, maybe most of you actually already know this, but the coronavirus, which is called SARS-CoV-2, which was first found in China in late November or early December, and then broke out of China and became worldwide in the early part of this year, is a respiratory virus that really finds a home in the lower respiratory tract, so in the lower airways and the lungs themselves, and can cause very severe disease. It is not like the flu in that. The flu also is a respiratory virus, but it gives you mild symptoms in general. This gives very severe symptoms. It results in about 12% of people ending up in the hospital and about 4% of people ending up in the intensive care unit, many of them on ventilators. So this is a disease that we need to have a great deal of respect for, but if we do the right things, then we can actually keep ourselves and our loved ones safe. So again, thank you for having me on the phone with you, and I'll be glad to answer whatever questions I can and be of help in any way that I can.
Thank you, Doctor. I also want to introduce Kevin McCann, who is the District Congressional Liaison from the IRS. Kevin, thank you so much for being on with us today.
Thank you very much, Congressman Brindisi. The IRS is focused completely on implementing the COVID relief legislation and providing as much help as we can, as soon as we can, for taxpayers. One of the biggest things that we're doing is working to deliver the economic impact payments, otherwise known as stimulus payments, to all eligible Americans. More than 150 million payments are being sent out, and millions of people who normally don't file a tax return are eligible to receive these payments. I believe we've sent out already to people's bank accounts something like 80 million payments. At this time, due to COVID-19, many of our offices and facilities are closed. So we're asking people, do not call us because they're probably not going to get anybody there. Check the IRS.gov website and the frequently asked questions that are posted there if they have questions about the economic impact payments. They're being updated on a regular basis. We've got 2 new tools that we created to help people with questions about the economic impact payments. The first tool is called the Get My Payment tool. That helps track payments and also helps with bank account information. It's very similar to the Where's My Refund tool used during the tax season. And some taxpayers who don't have a scheduled payment date, they can provide direct deposit payment on this app to speed their payment. We have another tool called the Non-Filers Enter Payment Info tool. And this is a tool really to help all the people who are non-filers, if you will. They're not required to file a tax return, but they're still eligible for an economic impact payment. And this includes people with little or no income, retirees, homeless, and many others. So we're asking folks to let people know that non-filer tool is out there for these folks. And it's available on IRS.gov. Using the non-filer Enter Payment Info tool, they only need to provide basic information, including their Social Security number, name, address, and dependent information. Again, the best source of information on COVID tax relief as well as the economic impact payments is IRS.gov and the frequently asked questions, which are frequently updated. And that's the best place to go to get information, because I know that both the congressional staff and myself at IRS and my colleagues were getting a lot of questions. So to help everybody from being overwhelmed, taxpayers should look at the FAQs before reaching out for help. Thank you. Happy to answer questions also today.
Thank you, Kevin. And our final guest tonight is Dan Rickman, who is the Deputy District Director for the Small Business Administration. Dan's been on our telephone town halls before, and I appreciate him for his service tonight. Thank you, Dan.
Hi, thank you for having us once again, Congressman. We really appreciate the opportunity to, speak to your constituents about what SBA is doing with respect to the COVID-19 relief efforts. So I'm sure most folks have heard of or are familiar with the Paycheck Protection Program that was recently refunded by Congress, and applications for the PPP program opened up Monday morning. I don't have today's numbers for the program yet, but as of 6 p.m. Last night, I am pleased to report that SBA had already approved nearly 1 million loans for approximately $90 billion in the 2.5 days or so up until yesterday at 6 p.m. And I think notably that this time around, smaller lenders are leading the way. A significant portion of those loans, over half of them in fact, totaling more than $43 billion, were from small community financial institutions and credit unions with less than $10 billion in assets. So the Congress, and with the new legislation, set aside funds particularly for those small lenders, and SBA also implemented updated processes to ensure that those small lenders have an equal opportunity to submit loans to SBA systems for approval. I think we're also seeing that with the average loan size. In the first round of PPP funding, the average loan size was over $200,000, and the current average loan size is $95,000. So we're definitely seeing some smaller banks and smaller businesses getting loans this time around. The best, much like our colleagues over at the IRS, for updates on any of these programs, you can visit SBA.gov. For the PPP program, you can visit SBA.gov/PPP for updates. This program was built from scratch less than a month ago, and new rules and clarifying guidance are coming out almost on a daily basis. So that is the first place you want to check for updates on the PPP program and our other COVID-19 relief programs that are available. We certainly do encourage you, if you, after viewing the website, have questions or having problems accessing any of these programs, you can also call our office. We're located in Syracuse, and we serve certainly the congressman's entire district and a good chunk of upstate New York. So you can reach us at 315-471-9393.
Thanks, Dan. Sarah, we'll turn it back over to you and start to take questions.
All right, sounds great. Just a reminder to anyone who has a question they want to ask, all you have to do is press *3. So let's take our first question. We've got Barbara in Rome. Can you hear us?
Yes, I didn't know I was live. Sorry about that. Yes, I am. I have a question regarding the tax relief. I have been on to the IRS website, so this is an IRS question. And it indicated they couldn't find me. I put all the appropriate numbers in, the dates, whatever else required, and it said, we can't find your file. Basically, they couldn't find me. I paid taxes in 2018, but I have not filed for 2019. Are the first checks out? Were they given to people who received refunds because it was in the bank system for deposit? How do those of us get payments when the IRS website indicated that they couldn't find me?
Okay. This is Kevin from IRS, and thank you very much for the call, Barb. As my colleague from SBA was saying, we put this program together basically in 14 days. So it's been a massive undertaking for us, and when you're talking about getting payments out to 150 million people, you figure there's going to be some snags along the way. So in terms of the payments that went out, I believe last week it was 88 million, and the first batch of payments were going to be for people who IRS had your tax information, and we also had bank information for you from whatever you did on your return. Now, I'm not sure if you had bank information on when you filed your 2018 return. The Get My Payment tool, by the way, I know you said you checked, they couldn't find you. Did you not have to file for 2019, or you just haven't needed to do it yet? I don't know if you're on still.
Yes, she won't be able to be a victim. Sorry.
Okay, no problem. At any rate, we made a lot of changes to that Get My Payment tool over this past weekend. So if you haven't tried that tool after that, after this, from this Monday on, I would say go ahead and try it again and see if you find yourself on there. But the option is also to go ahead and file your 2019 return as soon as possible, and you can do that on e-file. And e-file is the quickest way to file. You can do it for free. through the free file program. So that's probably what I would recommend in your situation, is just to go ahead and file your 2019. In terms of other folks who haven't gotten payments yet, because I've heard from a lot of people who said, everybody in my neighborhood got one, I didn't get one. Why didn't I get one? Okay, so we're committed to get those payments out to everybody who's qualified for them. And like I said, the first batch went to folks who had bank data, and we had tax filing information from them. After that, we worked with the Bureau of Fiscal Services, Financial Services, Bureau of Fiscal Services, which is the Treasury unit that pays out money to folks. And so the reason why we were able to do so much in those first 3 weeks was they can do like 25, 30, almost 30 million electronic payments via banks. They can only do paper checks 5 million a week. So the first batch of paper checks, so if we didn't have your bank info, it will go out by a paper check, and we send out 5 million a week. And with that kind of a time frame, you know, it could take several weeks, maybe even going into August, as far as when you might get your stimulus if you're getting a paper check.
All right, thank you so much. Just a reminder, it's *3 if you've got a question you'd like to ask. So let's take another. We've got Christine from Oxford. Christine, can you hear us?
I can.
We can hear you.
Good. I was wondering about the availability of testing in these rural areas. I had a friend who was ill and waited a month for a test and finally ended up having to drive to Binghamton to get one. That's kind of a ways for us here in Oxford, and so that was my question. What's happening with testing?
This is Dr. Hall. So testing has been very difficult to get. We certainly don't have as many as we would like. We are allocating tests, and unfortunately, we living in a rural area, some of the more rural parts of our rural area are finding tests to be a very difficult thing. We are trying to get those out as much as possible. I know that there are a number of tests that are coming out now, both tests for the virus itself as well as the antibody test, which actually works to find out whether not if you are infected or have the virus in you, but whether you had the virus at some point in time. So we are getting more testing, but unfortunately it is not coming out as quickly as we would like. If you're looking for testing, I know that the Rite Aid in Utica is doing some drive-in testing, and I know that certainly you can call your primary care provider, or you can go to a local urgent care, and they should be able to get testing for you. I would recommend that you give them a call first, because it may be that not all urgent cares have those tests available.
I will also just mention that we have to have more testing, and there is more testing on the way. Congress did add $25 billion in additional testing money last week and directed the administration to come up with a national testing strategy. I think we also need to have more contact tracing like they're doing in other countries right now. There are some drive-through sites that are being set up. That the doctor mentioned the one in New Hartford outside of Utica. That's one that's been set up in conjunction with the Department of Health and Human Services. I was speaking to someone from the governor's office today, and I am aware that the governor's office, through the Department of Health here in New York State, is also going to be setting up a number of testing sites throughout the state starting tomorrow. So if you want to reach out to our office, we can try and find what will be located closer to Oxford. or any part of the district, feel free to reach out to our office and we can do a check and see what's on the way in your neck of the woods.
All right, thanks so much. Let's take another question. We've got Scott from Binghamton. Scott, can you hear us?
Yes, I can.
All right, you've got a question?
Yes. I know that you said kind of the beginning that New York State has kind of been hit the hardest with this, and basically, in my opinion, it's kind of like a national disaster. And the state reallocated a lot of their sources pretty quickly, pulling a lot from state agencies, counties, municipalities, but now those resources need to be replenished. When Texas or Louisiana gets hit by a natural disaster, there's no talk about making those states go bankrupt or any of that other nonsense. There's no nonsense about saying, state pension funds. You as a member of the state assembly know how robust New York State's pension system is and is well funded. Now I think in the next relief package there has to be a portion that goes to the states and the counties and municipalities. State, fire departments, unemployment, all those need to be replenished. So I want to know what the plan is to have those replenished.
Well, thank you for that question. You're absolutely right. New York has been hit the hardest by this pandemic. We are the epicenter of the pandemic, and it has caused significant fiscal stress both to the state and to our local governments. That is why I'm very much pushing in the next coronavirus package, which will be coming out of the House, to make sure that we are putting funding towards making sure state and local governments are properly funded for the losses they have received as a result of the COVID-19 pandemic. Because if we do not get federal assistance here in the state and local governments are going to be forced to make some very tough decisions, and they are going to look to cut health care, first responders like police and fire and EMS, other areas that have been very important to the response to the public health crisis. And I think it's very insulting for anyone to say that we should just declare bankruptcy. This is not about covering past losses. This is about covering the losses that we have received as a result of this pandemic. And whether the crisis is in New York or Kentucky or some other state, we're all Americans, and partisan politics should be put aside, and we should be there to help our fellow countrymen and women.
Thanks so much. Next, we've got George from Utica. George, can you hear us?
Yeah, I'm here.
You've got a question.
Yes. This for the IRS. I am a disabled vet, and I have direct deposit set up with VA. So how will this stimulus check work for me? Because I didn't file taxes in the past 3 or 4 years, but I do have direct deposit already set up for me through the VA.
This is Kevin George from IRS. Thank you for the question and your service. As a vet receiving veterans compensation, you will get the payment automatically sent out to you. I believe it's probably not going to happen until, I'm going to say, sometime mid-May or later. But we were able to make arrangements with the VA to get the data for folks on veterans disability compensation, and so that they don't have to do anything to get the payment. Now, there's one slight wrinkle with veterans on VA compensation, and that is if you have any dependents that would be eligible for the stimulus, we do have a tool that you can use on irs.gov to claim that dependent, and that dependent would then be eligible for the $500 economic impact payment as a dependent. So if you don't have any dependents, no worries. You don't have to do anything. If you do have eligible dependents, then you'd want to go ahead and go to irs.gov and use that non-filer tool to put in that dependent. So that's what you would need to do.
All right, great. I think that we've got a lot of constituents with similar questions. Next, we've got a question from Sue in Green. Sue, can you hear us?
I can. My question is for the doctor. With these meat packing plants suffering a great deal with their staff having the virus, how does this affect the meat? Is there a concern about contamination of the meat?
Yes, Sue. So that's really an excellent question. Thank you for asking that. So the short answer is no. This virus doesn't really fare well on non-living meat, and so certainly with the packaging that goes with the meat and the fact that it's sent over long distances, the meat source itself should be very safe.
Excellent. Thank you so much. We've got a question from Carol in Norwich. Carol?
Yes. I just wanted to ask about how long we're going to be expected to wash our produce and the various items that come into our house from the grocery store. And I'd also like to thank the grocery stores here in Norwich for being really helpful in getting food out, particularly to elderly people who don't want to leave their homes. So I guess that's a question for the doctor. How long should we be, washing all of our bottles of milk and that sort of thing? Thank you.
Sure, Carol. That's, again, another great question. And, this virus has been shown that on hard surfaces, it actually lasts for a little bit longer, which is why, wiping those things down that you get from the store, the plastic containers and such, is really a good idea. So my recommendation in terms of how long, that's a little difficult to give you a concrete answer for. Because it really depends on what's going on with the virus itself. So if we notice that we're seeing a significant decrease in the amount of people who are infected, and that the virus looks like it's going quiescent, then I think that would be an indication that it's safe to stop doing that. Certainly also, when we get a vaccine that is good and enough people have it so that there is what we call herd immunity, then that would mean that really the chance of getting the virus becomes that much smaller, and then that's when we can really start to relax some of these things that we've been going through.
Wonderful. Thank you so much. We've got another question from Charlie in Yorkville. Charlie, can you hear us?
Yes, I can.
You've got a question.
My question, yes. I served in Vietnam for 2 years, which gave me the incentive to go to nursing school when I left the Marine Corps. And as a graduate nurse, I attended the emergency room services for over 30 years. And my question is, because of my health conditions, I cannot publicly join the team, which really breaks my heart. My primary is offices, and I'm sure many other offices are inundated with phone calls about geez, I have this symptom, I have that symptom. Should I go to the emergency room? Should I go to urgent care? Whatever. I would like to know if it would be possible to set up something to take the screen off the primary care offices and allow the professional nurses, such as myself, to answer these questions and direct them accordingly, either by phone or teleconference.
That's a good question. Doc, are you hearing anything about just the level of calls coming into primary care offices, or the need for any help answering questions or anything like that, or a resource for folks who need information?
No, it is a good question. We in the medical profession in general, not just Mohawk Valley Health System, but really across the spectrum, are doing as much as we can to reach out to our patients and to people who may not be our patients but may become our patients, to provide them whatever information we can. I know that a number of folks are using telehealth services with things as simple as FaceTime or Zoom in order to have face-to-face contact, at least over a screen. We are certainly fielding questions also. I also know that the state, both the county governments and the state, have set up hotlines where you can get information as well. I will say that the emergency departments across really the country have seen a dramatic decrease in the number of people visiting them, and yet I will tell you that heart attacks and strokes and appendicitis and things like that have not taken a vacation. So there is real fear that people are staying home because they're afraid of going to hospitals, even though they may be having symptoms of something that could be pretty significant. So when you're in a pinch and you don't have anybody to call, you can always pick up the phone and call the local emergency department. They will answer, they will listen to what you're saying, and they will tell you that whether they think that it's best that you come to the emergency department or whether you go to a local provider, whether it's an urgent care or to your primary care office.
And I think there's going to be certainly a greater emphasis on things like telemedicine after all of this. And I know in the CARES Act there was an expansion of telemedicine, and Medicare and Medicaid are authorized to pay more for telehealth visits. So there might be some more need for folks who are properly trained to be able to help with telehealth and telemedicine going forward.
All right, thanks so much. We've got a question from Michael from the southern tier portion of our district. Can you hear us, Michael?
I can, yes, thank you.
We've got a question.
Congressman, thanks so much for hosting this and for bringing us the panel. I really appreciate the work that you're doing on our behalf. My question or comment is really about public education, and I'm very concerned as a parent and also a taxpayer about the impact that the fiscal impact this is going to have on public school districts and the SUNY system. So I would like to hear you speak a little bit about how to mitigate that, and to have you focus on the possibility of including that in the next round of stimulus. Thank you.
Absolutely, Michael. That's a great question. I appreciate that. And as a former school board member and now a parent of two children in public schools, 12 and a 9-year-old, I too am very concerned about the impacts on the school system moving forward here. And I believe that there has to be funding, direct funding I would like to see to our local school districts with no strings attached, not adding new requirements like have done in the past on testing and things like that. But I am worried that if we don't see strong support in the next coronavirus package for our schools, our state and local governments, than the very folks who have been keeping our economy moving and helping to respond to the public health crisis we've been facing are going to be facing pink slips. Our teachers, our healthcare workers, our first responders, police, fire, EMS, these are the folks we've been relying on right now, and I think it would be an insult to them if we turn around and don't properly fund places like New York, which have been hit the hardest, and our local governments and school districts as a result of the pandemic. So we need emphasis on funding for schools. We did establish an education stabilization fund in the CARES Act to help ensure learning can continue despite the challenges posed by COVID-19, and the legislation also provides resources for our K through 12 education system. There was also funding in the CARES Act for higher education. In fact, I announced funding for our colleges and universities throughout the district last week, I believe, and we also need to make sure that we have a strong higher education system going forward here, and that that money is also going to help students who have been impacted by a disruption in their education.
Great. Thank you so much. Next, we've got a question from Lisa in Newport. Lisa, can you hear us?
Yes, I can.
All right, you've got
Can you hear me? I do.
Yeah.
I'm wondering, with all these stimulus payments, it's great to have that money, but what happens next year when I go to file my taxes? Is this going to count against me as income? Is this a loan and I'm going to have to pay it back? And if we get more, then what happens? Because, I mean, it's like I said, it's great to have that money, but some of us, when it comes time for tax return, we can't afford to lose that money back as income when we're depending on it then.
Kevin, do you want to take that question about the tax implications there?
Yes. Thank you, Congressman. And Lisa, thank you for the question. Excellent question. Basically, you know, when you get the economic impact payment, you're going to get an IRS letter. And I will say, save that IRS letter for when it comes time to file your 2020 return. If you know, for some reason I know we're getting people that are saying this, that they got the payment for themselves, but no payment for the dependents, for eligible dependents. So those folks can, when they file a 2020 return, they can claim the dependent on that return. It's really like a recovery rebate, and so it's not taxable, and so you do not have to pay it back. With one exception, and that is we've been getting a lot of questions about what happens if the IRS sends a check to a person who died within the last year or two. What has to be done with those payments? So with that specific question about the decedents, we do not have official guidance on that yet. So I would just kind of hold on to that until we're able to come out with guidance. But for anybody else who gets it, no, don't worry about tax time next year and when you file your 2020 return coming January. And by the way, I'm sure everybody knows that, maybe not, but I'll just say it anyway, and that is if you did not file your 2019 tax return already, which would normally be due on April 15th this past, we, as part of coronavirus tax relief, we extended all the payment deadlines and the filing deadlines to July 15th. So folks who, haven't filed for 2019 yet, they don't need to worry, at least until July 15th, when it is now due. Having said that, I will say that if you haven't gotten your economic impact payment, if you didn't file a 2019 return, you might want to go ahead and file that just to kind of trigger your economic impact payment. But Lisa, just save a copy of the letter for when you file your return for 2020.
Yeah, that's we've been getting a number of these questions into our office too, Kevin. So the IRS does not treat it as income, correct?
Correct. We don't treat it as taxable income. Yeah.
Okay. And the other thing too, I wanted to see if you could clarify. This will not affect a person's refund next year, right? This is not considered an advance.
Correct. It should not affect the refund next year.
Okay. Thank you.
Excellent. We've got another question from Larry from Greene. Larry, can you hear us?
Yes, I can hear you.
All right, you've got a question?
Yes, for the congressman. Governor Cuomo has been very vague on when he's going to be reopening the economy, either statewide or locally. I know our cases up here in this area are not as bad as down in New York City, Westchester, Long Island. Is there any way that he can open up the upstate economy sooner?
Thanks for the question. Yeah, I know I certainly want to see everything, and I know everybody wants to see things get back to normal here. And I'm hoping and praying that we will be out of this by the summer here. But we really need to listen to the experts like Dr. Fauci and Dr. Birx. And I believe the governor is committed to a regional approach to reopening our economy, and that will likely start with upstate New York because the upstate area has not been hit as hard as New York City has been. But my understanding is that there will be regional reopenings starting May 15th. And the governor's assembling a task force for each region to oversee that reopening strategy. So it will be done on a regional basis.
All right, great. Let's get to another question. We've got a question from Nancy in Whitesboro. Nancy, can you hear us?
Hello, I'm here. This is my question. I want to start by saying I'm 72 and I have underlying health conditions of concern. I'm planning to vote in the June primary by absentee ballot. I would love to vote in November by mail. I don't want to stand in line and risk getting infected. And I know November is a long way away, but still, we're not sure what's going to happen. Having said that, I'm alarmed to hear that the post office is running out of money and that some people are unwilling to let the post office have money even if Congress says, yes, we're voting more money for it. I'm upset. I'm concerned. I want to vote by mail, and I want there to be a post office that will be there to deliver my ballot to the Board of Elections. I'd love to get more information and input. Is this an accurate concern? Can this be changed? Help.
Well, thank you, Nancy. This is Anthony here. Look, I agree. I love the Postal Service. The Postal Service is as old as the Constitution. I think we have to save our Postal Service here, and Congress is looking at ways right now how we can do that. I'd hate to lose the Postal Service. I think it's a great institution in our country, and we certainly have to look and see what we can do in Congress to make sure that they can continue operations. So, in terms of voting in November, I know as of right now the June primaries, my understanding, and this is handled at a state level. The June primaries can be voted by absentee ballot. Not quite sure what's going to happen in November yet. I think a lot of this all depends on public health crisis and where we're at in the fall in terms of the virus.
All right, great. Thanks so much. Let's get another question. We've got Robbie from Frankfurt. Robbie, can you hear us?
Yes, I'm
right,
here.
Got a question?
Well, I've got a couple. My first question is about the SBA loans. I have a small business sole proprietorship in Ilion, New York. The first round, I just hit my head against the wall every step of the way. I did get an application into the EIDL. I have gotten no response whatsoever as far as if I was getting any money or not. I did call and was told that you get $1,000 per 3 employees, so a sole proprietorship, the maximum I could get would be $1,000. I went to apply for this next round on Monday, and I was told I could not apply because I had already applied. My bank did not offer the SBA loan, the PPP loan. This time they did offer it, and when I called its M&T Bank, they told me not to apply. I couldn't apply because my Schedule C on my tax return showed a loss. So that's my first question about the SBA loans. My second one is unemployment. I filed for unemployment. I was the early stages of the unemployment, so when I filed, I had to wait to be declined. When I was declined, then I was told to apply for the pandemic unemployment. I have done that. I did it weeks ago, and whenever I check, it says your claim is in pending status, no payments have been made, and on and on and on. And also, I still have not gotten my IRS $1,200 check, and every time I go to check that, I am told that it just, when you get my payment, it says the tax return information you entered does not match our records, and it does. Or I have tried too many times in one day, and I only try once a day. So I've struck out on all three. So I guess I have a question for the IRS and the SBA. Thank you.
Hi, this is Dan with the SBA. So I just wanted to sorry to hear about the troubles you've been having accessing some of these programs. With respect to the Economic Injury Disaster Loan Program, I can say that those applications are continuing to process in the order that they were received based on the additional appropriations that Congress made for the program last week, that's simply the best advice I can give, and is to monitor your bank account for the advanced portion of the loan, because those come without any notification. There's been some examples where folks missed the direct deposit and called us back to let us know that they had received it. But it's due to the sheer volume of applications, it's difficult, or we don't really have the ability to tell where somebody is in the queue, so to speak. So that's something that I'll eventually process, and ask you to bear with us. For the PPP program, Congress, it's designed to protect paychecks is the primary purpose of the program, and Congress did make it available to self-employed, sole proprietors, 1099 individuals, folks like that. But they did base it on net earnings. So, the rules that were issued kind of reflect that if, best thing we could rely on is the Schedule C from your 2019 tax return, for example, because that's how it demonstrates what the net earnings from self-employment are. It sounds like in your case that, unemployment is also an option for self-employed individuals, and based on your net earnings from last year, that's probably going to be the most beneficial, purely from a cash flow perspective. I think maybe the congressman can speak a little bit more intelligently about the unemployment than I, since we're kind of wrapped up in the other programs. But for those that, folks that are listening in, the PPP, it's not going to be appropriate for every circumstance, and with that being said, some of the resources we have at our disposal at SBA is to, kind of help you figure that out, and determine, if you'll be able to calculate a loan request, for example, and navigate all this stuff. If you visit our website at sba.gov/local-assistance, or just go to sba.gov and look for the local assistance tab, that's how you can get the help you need, to help you talk through all of these things, including getting a hold of us in our office.
And on the unemployment, I can certainly, our office can make an inquiry with the New York State Department of Labor to see what is going on with that. I know at the end of this call, there'll be an opportunity for folks who did not have a chance to ask a question to be able to leave a message. So I would just encourage you to leave your contact information and your question, and we can certainly make an inquiry with the unemployment office about the status of your situation.
And this is Kevin from IRS, and Robbie, I like that name. That's my wife's name. Sorry you haven't gotten the $1,200 economic impact payment. We have, one of our FAQs is why am I getting payment status not available on IRS.gov? And based on what you said, it meets, it says the application doesn't yet have your data. We're working on adding more data to allow more people to use it. So I don't know if we have your bank data from your 2019 return, but if we don't, you probably get a paper check. And like I said, the paper checks, that's a process that started, I think, this week, and it's going to run probably into August. But you can keep, check that tool. You can check it once a day because we update it once a day. Again, sorry, you haven't gotten it yet.
Thank you guys so much. A lot of complex questions there, a lot of great answers I think are going to help a lot of people. And I can't believe it, but we're already almost at 6 o'clock. So I think that was our final question. So Anthony, do you have any final thoughts for us?
Thank you, Sarah, so much for moderating. And again, thank you to Dr. Hall and Mr. McCann and Mr. Rickman for their expertise on tonight's call. Like I had mentioned earlier, I wish we had a chance to get every question in there. We had a lot of questions, and if you did not have a chance to have your question answered, please stay on the line. There'll be an opportunity for you to leave a voicemail. All of our staff is working remotely, answering phone and email. So please don't hesitate to reach out to our office if we can be any assistance. That is what we're here for. We're here to try and answer questions and connect you to the resources you need for any of these programs. Thank you all again for joining us tonight. I want to make sure that also you guys have the information on our website. It's a one-stop shop for COVID-19 assistance. It's brindisi.house.gov/coronavirus. brindisi.house.gov/coronavirus. That's the one-stop shop for COVID-19 assistance, and we have all the information and useful links on there. Thank you all again. Please stay safe, and good night.